All right, so greetings everyone, and thank you all for coming out, and welcome to another webinar brought to you by LHEWco under the theme Breast and Prostate Cancer in the COVID-19 pandemic era. All right, first, let me introduce myself. I am Tamar Heron, better known as Stretch, and chair of the UHWI Library Health and Wellness Committee. I am responsible for hosting this meeting presentation today, and I am glad to welcome Ms. Lynch and Ms. Satchwell, who will share with us their breast cancer survival story, and Dr. Aiken, who will be presenting on our prostate cancer under the theme, the effective effects of COVID-19 on breast and prostate cancer in Jamaica. All right, at the end of this webinar, we'll ask the speakers to share some question and answer. You can raise your hand in the chat and I'll identify you, then unmute your mic, and you'll be able to ask your question, or you can type your question in the chat. It will be asked thereafter. It is customary for us to start our webinars with a word of prayer. And after the word of prayer, we'll invite Dr. Carr, our campus librarian, just to bring greetings to us. After that, we'll be hearing from Ms. Satchwell. So thanks again for joining us, and let us go to prayer. Our most righteous and heavenly Father, we come before you once more to tell you thanks and to acknowledge your presence. As we proceed with this meeting, our Father, we ask that you may give us the guidance that we need, the listening ear that we need to take heed to the necessary precautions that need to be taken to make sure that we take care of our bodies the way that it is supposed to, and will enable us to efficiently carry out our daily task. 2020, our Father God, has been a very tough year, and we know that at the end of this road, we still acknowledge you as God and our Creator. So come into the midst of our meeting now, Father God, so we can have a smooth proceedings. Thank you. In your heavenly name we pray. Amen. Dr. Carr.
Thank you so much, Mr. Heron. Just to say welcome to everybody. It's really, really good to be part of this, this webinar. And I really want to say thanks to our health and wellness team, led by Mr. Heron, because in the midst of all that has happened during this period, sometimes if we're not careful, we tend to focus on getting the work done for our students and for the faculty, making sure that the resources are in place. We went online very, very quickly. And so part of the challenge is to ensure that in the back of our minds, we are also thinking about our staff. And I think the health and wellness team, they have, from the very, very outset, kept us grounded by saying we really need to address the challenges that the staff would be going through and how the staff would really be helping other people and making themselves ready during this period. So from very, very early, I remember and maybe Mr. Heron, because Mr. Heron wears different hats in the library, from very, very early before we even had that first case in Jamaica, Mr. Heron said, Dr. Carr, we need to have a meeting to talk about how the library is going to manage in this pandemic. I don't think it was even named a pandemic as yet. And so we had a team from the Faculty of Medical Sciences coming in. But since that, during the pandemic, we've had, this is going to be actually our 4th webinar. And I know today is a difficult day because there are competing events happening for staff today. But we had Creating a New Normal Life in June. In July, we had Your Health is Your Wealth, where we talked about how to eat and stay fit. And then we had in September, the emotional roller coaster of the COVID-19 pandemic, which actually brought to bear for the staff. And actually, we extended it to the entire community, that particular one, because we were looking at research that spoke to the how the university community was dealing with the pandemic and how staff were dealing with it. So I really want to say thanks to the team for pulling together these webinars. And when I saw that we were talking about prostate and breast cancer, you notice I have on my, well, you can't see it, but I have on my breast cancer pin here. I think 2 years ago, we had a drive in the library. And so I have been wearing my breast cancer pin for the month. And it's not only for the month because it has come close to me. And we have had closeness in this library too, because we've had a colleague who actually had breast cancer, and although went into some kind of remission, we actually lost her after because of complications afterwards. And certainly I've lost a family member from prostate cancer. And I've had very, very good friends who in recent times actually have had breast cancer. So I think this is in the midst of what we're going through with all that is happening. I think it's very good for us to touch base on some of the things that continue to happen to us as staff and how we can, if and when they happen, how can we deal with it? And so I'm glad that Mr. Heron invited 2 persons who actually have gone through and so could share with us freely, how they manage. And also an expert, Dr. Aiken, on prostate cancer. I'm hoping that more of our men will be on, or staff will be on the session. But as Mr. Heron reminded me on Wednesday, not to worry, because it is being recorded and we can actually share this at one of our staff meetings so that everybody, those who are otherwise occupied, everybody will get a chance to participate in this session. So thank you all, Ms. Lynch, Ms. Satchwell, and Dr. Aiken. Thank you so much for agreeing. And thank you, Mr. Heron, and your team for arranging this. Thank you, the systems people. And I am looking forward to a very, very good session. Thank you very much.
And just before you hear the presenter, I just want to remind persons or highlight an interesting fact that breast and prostate cancer combined are the leading cause cancer in Jamaica, right? Where we are seeing some 1,000 new prostate cancer, but I'm not the expert. That's why we have Dr. Aiken here to tell us about that, and some over 900 breast cancer each year. So we are definitely in the right place, and it is the right month. And last month, Dr. Aiken, was Prostate Cancer Awareness Month, right? So now we have combined the two, and so we are going to turn it over now to our presenters to share with us.
Is that me, Mr. Heron?
Yes.
Okay, ladies and gentlemen, good morning. My name is Dorothy Satchwell, and I am from Misty Blue Cancer Care Foundation. It's a cancer education and support group that is in the parish of Westmoreland, and we have been in operation since 2015. It started I started it after I had my cancer diagnosis and treatment. Oh, so as for my diagnosis and treatment, where do I start? I was diagnosed in March of 2011, but I actually knew I had cancer from January 2011. The lump was very prominent, but I used that 2 months for what I call my deliberation. Deliberation because prior to cancer, I'm a lupus patient. I have Raynaud's, I have asthma, I have rheumatism, and I can't remember the other one, and most of those, as you know, they're all autoimmune diseases. So if I was to accept that I had cancer, it was almost like accepting that I was going to die. And I do not go down the death road, right? So I remember with all of my illnesses, because I've lived most of my adult life in England. So one of the things that the health service had done, because of the combination of my illnesses, was to have sent me on a course that is called condition management. And one of the things that I learned from condition management is that I have to understand the features of whatever illness that I'm going through, and how my mind is going to help me to get over it. So when I found the large lump in my left breast, I then started deliberating with God, because I'm a woman of faith, and that was the time when I said to God that, listen to me now, I know you're good, I know you're reliable, I know all of that, but guess what, God? You're not going to work this time, you know, because me ain't going dead, because me don't ready. And I had to make a list and present to God and say, look here, God, if I have all of these illnesses, right? How can anybody fight cancer and survive without an immune system? So you need to go back to the drawing board. And I would get up every morning at 5 o'clock and I would go for a walk. And I don't know how the community members did not call for the people in white to come for me, because I would walk and gesticulate, and they're having my conversation with God to let him understand that in around this time. Yeah. So I had my Damascus experience about 2 o'clock one morning. I was sleeping, and it's like somebody had poured acid on the breast. And I jumped out of my bed. And I said, okay, God, I get it. I get it. You're in charge. I am here. I'm willing to listen, and I will obey. And I got up the next morning, and I went to the doctor. And we had a little chit chat, and he said, what can I do for you today? And I said, I have breast cancer. And he apologized and said, how long ago were you diagnosed? And I said, well, you'll have the privilege of doing that this morning, because I'm not here to diagnose. You're going to do that. The poor man was wondering if I was loopy. But that day I did the ultrasound and I did a mammogram, and they sent me to go and do a biopsy. And I knew what was coming, because I had 2 months to deal with that. My sister had been diagnosed and got treatment for breast cancer 2 years before, and 4 years before that, my girlfriend that I had supported right for breast cancer had died. So I sort of knew what was coming. I had only just returned to Jamaica, like for about 3 months then, or 2 months. So what I did when I got the result from the radiologist, I sent it to my doctor in England and said, what do you think? He said, you need to take the next flight. I said, I'm sorry, I can't, because on the same day that I got my result, my girlfriend's husband had succumbed to cancer. I had been supporting her for the last 7 years. So I said, you don't start a race and you don't finish it. So I had to stay for the funeral. So the funeral was planned, packed my bag, went to the funeral, and left the funeral to the airport, went to England. Because I had done a mammogram the beginning of November, came to Jamaica the 27th. So, and I had gotten back the result by then to say I was fine. So the worst case scenario is like I would have been at stage 1. So I would have been able to go back to England, just deal with the situation and come back. I had end stage. I had end stage cancer. And that was the start of my 18 months of horrific treatment. I try not to be very detailed about what I went through, because it tends to scare people. All I can tell you is that by the time I got to chemo number 2, I was given 24 hours to live, and the priest was calling on my family members for them to do what they had to do, because that was it. But one of the things that I had gone through during my deliberation is that I had said to God, I'm asking you for one favor. Let me live, and whatever that you want me to do, I will obey. So you let me live and I'll obey. I have one child, and we were very, very close. And I know that Mario could not have made it without me, because I don't think he was at that stage. So I had 7 surgeries. I had chemo, I had radiotherapy, I had hormone treatment. And I must also tell you that I have adverse reaction to anesthetics. And the only medication that I can take as painkiller is like paracetamol, because I'm allergic to opioids. So anything with opiates I can't take. And you can picture me doing a 10-hour surgery and not being able to take any medication that is opioid based. But one of the things that was very, very good for me is that the medical support that I got in England was top of the line. It was superb. I had one of the most supportive medical team. I had about 3 voluntary cancer organizations that supported me, that would take me up every morning, carry me to all of my appointments. They would come home, they would do just about everything for me. They were there with me every step of the way. I had friends who were supportive. And where I was concerned, I had to make the decision from day one when I had my diagnosis that I was going to be in control of my mind. I had to make a decision as to who I allowed in my space, because that for me was very, very important. So with anything, especially with health that is happening to you, everybody have an idea as to how it is the best way for you to get through this thing. And everybody is going to come and tell you whether you're going to live or you're going to die, and whether you had done anything in your past, for God is going to punish you, or God knows best, so probably it is your time to die. I decided from day one that I was going to be my gatekeeper. I was going to decide who visited me, whose phone call I took, and who's I allowed in my space. Because once you have all of that negativity coming at you, then you don't have any control over how your mind is going to react to these things. So that for me was very, very, very crucial. And my spiritual life was always paramount, because I told myself from day one, my doctors are fantastic. I have good friends around me. However, their capability for me was limited to what God was going to allow them to do. And from day one, I took God's word that I was going to live. So I remember one day, one of my doctors broke down and she cried, because she said, every test that I did came back to put me 1 foot closer towards the end. And the only question that I asked every time that I got a result, so how are we going to deal with this one? And one day she said to me, Dorothy, I need you to tell me, how is it that you are doing this? She's Muslim. And I said to her, it's the Serenity Prayer. She said she has never heard it. So I gave her a copy. And I'm known at my hospital as a Serenity patient, because for me, it was important for me to do all of that. I understood, one of the other things that benefited me is that I also studied nutrition and used to teach nutrition. So I was sort of, I did a lot of research in terms of the foods that I would have needed to replace the nutrients that I would have been losing through my illness, and to make sure that my immune system was up to stand at all times. So I was basically very much ahead of time. I was very, very interactive with my doctors. And they knew at every appointment, I would have my notebook that I will go in and I say, doctor, this is what I've gone through. And these are the questions that I have. Because once you go to a doctor, you tend to get overwhelmed. And that I say to persons who are going through cancer or any type of debilitating illness like that, allow somebody to go with you at all doctor's appointment. And if you can't find somebody, write down the questions ahead of time and give it to your doctor and say, doctor, this is what happened to me during the week. These are the things that are going through my head. And I need to go home and explain to my husband. I need to go home and explain to my mother. I need to go home and explain to my children what is happening to me. And doctors sometimes, unfortunately, talk to patients with medical jargons. I had a lady last week who I was speaking with, and she was going to do some tests. She had no idea what was the name of the test. She had no idea what it was for and what was the purpose of it. And I'm saying to her, okay, doctor wants you to do something. Why does he want you to do it? What is the anticipated outcome? Me no know, doctor said me to do it, I'm going to do it. And the things that what I have found is that when you have an understanding as to what is it that you're going to do and why. Doctor is going to give me radiotherapy because he wants my lung to shrink before he can do a surgery. I'm going to do chemo because of, I'm going to do surgery because of. And once the patient knows that, because people like me, I have that inquisitive mind. I always want to know why. And therefore, doctor, my medical team, luckily for me, understood that how I was, and that I was going to work with my notebook at every visit. And if I'm too weak, I said, doctor, please to write down the answer in here. So when I go back home and I'm feeling better, I can look back at it and I can have an appreciation. I need to understand how my medication was going to impact me. So when I go home after a doctor's visit and start taking a new medication and I feel like crap, it is not that I am getting worse, but it's because the medication is going to react in that way. And you will feel like that for the next 24 to 48 hours. But if it persists, you need to call your doctor. So it is very important that, and once you have those things, that was what I did and what I have been doing for the past 9.5 years to survive. Because the unfortunate thing with me is that I had 3 of my organs that were, according to doctors, that it's going to be like that for the rest of my life. I don't know. That's what doctors' version, but I've had good days and I've had bad days. I have a heart condition and I have problems with my gut, and I have problems with my vision. So I struggle with those as a result of the treatment that I have, but I understand that it is a side effect of my treatment, and that if I do certain things, I can live with it. You understand me? And I encourage persons that if you tell yourself from day one that you're going to die, you will die. Okay? And if you tell yourself that you will live, and then not only tell yourself that you're going to live, but you have to make it that you will live. Get up and walk and do something. Yes? Take your medication. Okay? And stay in tune with your body. You go to doctor asks you, so Miss Brown, how you feeling this week? How are you this week? You have any pain anywhere? Anything? Me don't know, doctor. Because if you don't know, doctor is not going to know, because doctors have the medical knowledge, but they can only use that medical knowledge in relation to your specific situation. So if you can't relate and tell doctor how you did feel, yes, and how you're feeling now, then they can't help you. So you're gonna have to help doctor to help you. You get me? And I find that when you have that approach, that it makes a lot of difference. I'm concerned about my country where cancer is. When I look at the RGD data for the year 2018, 17,400 people in Jamaica died from cancer. And that's a whole heap. That's 17,400 families that have lost a loved one, a breadwinner, yes, a parent, a husband. And every time I go to a funeral, people cry and bawl and carry on. I try them out of family dead, you know, wonder who next. And my question is always, 3 of them have died, but what is it that you are doing to make sure that you are not the next one? Because we can't sit down and say cancer will kill people. You need to ask yourself, what is it that I can do to preserve my lifespan so that I do not have to become one of the statistics? What is it that I can do for my friend, my coworker, my church sister, my neighbor, to make sure that they can be one of the ones who live and not one of the statistics? And once we take that collective approach, I think that we can make a fantastic difference, a significant difference, because we got to be our brother's keeper. We need to understand that persons who go through cancer is not only a physical thing, it is largely psychological. Yes, and therefore, what I find with us cancer patients is that don't sit down and say, Dorothy never asked me if you do anything to help her. Because Dorothy is not going to ask you, because she already thinks that she's a burden to her family. Yes? So say, okay, Dorothy, I know that your child goes to so-and-so school, you normally take her to school. In the carpool, I will pick up your child for you in the morning. Oh, I'm going to the market on Friday, you know. You want me to buy any orange for you? Me know your orange lady, so I can do that for you. Yes? And those are the type of things that you can do. You're a co-worker, and you know that your co-worker normally does certain things, and you go just buy their lunch and talk shop for them. And don't sit down and ask, me no know I'm there because she don't ask me nothing, so me don't know, so me not able. Yes? Because if you are your brother's keeper, you're going to have to be able. to do something to make a difference, and it will be appreciated. Because if you're going to sit around and wait on somebody to ask you, what can you do for me? Nothing, because you are taking away from me my belief and the fact that I am no longer a good wife, I'm no longer a good mother, I'm no longer a good parent, I'm no longer a good co-worker, because I can't function in the way that I used to function. I'm already feeling shortchanged. So when you come up and ask me, I want to feel sorry for me. I don't want your help. I don't want your help. But if it is the approach that you use that is going to make a difference to that individual as to how receptive they are of the help that you offer, okay? And when it comes to cancer, I talk forever, so I'm going to shut up. I think my 5 minutes is up. And in the event that there are any questions, I'm willing to answer if I can. And I'm very, very grateful for the opportunity to have been able to share with you today. And I just hope that others will do the same thing and let cancer awareness not be something that we're aware of that is out there, but we actually do something, because awareness is nothing until we actually act on it, okay? And thank you very much.
Wow, you haven't gone in details in accordance to you, but already my heart is filled with so much emotions that you have actually expressed to us just now. And you have made mention of some very, very important thing, and that can be applied to the wider society, the wider life, generally speaking. Support is key. When you make mention of, you already have this psychological burden carrying, like, all right, you're on a death sentence, right? And then you have feel burden within how you're going to cope. You're talking about your only child. How are you going to, what kind of support mechanism is there to support that child? And then you have persons coming in to you with negative attitude. It just adds to the flair. So I really and truly am thankful for your presentation, and I am touched. I am touched. I know that breast cancer has a significant damage on our nation and our women in particular, because men have breast cancer as well, right? But in particularly our women, so thank you very much for sharing with us. And any more comments or questions raised, then I'll bring it to you. All right, Ms. Lynch.
Can you hear me now?
Yes, I can.
Okay. Thank you, Ms. Satchwell. Wow, that was really a good presentation. Good morning to everyone. Thank you, team from UWI, for having me present in your webinar. I'm very honored to do so. I must begin by indicating that I'm a member of the Jamaica Reach to Recovery Group. This is the breast cancer support arm of the Jamaica Cancer Society. And we are a group, we normally meet physically in Kingston every second Tuesday of the month at 5. But because of the coronavirus and the change in the whole world, we have gone virtual currently. The group seeks the support to persons who have gone through this illness, because as Ms. Satchwell rightly said, once you have gone through cancer, support is critical. And breast cancer, especially for women, is something that can take a toll on your mental when you think, I'm losing a breast or I'm losing both breasts. And that's an identifying mark of the female. And so that tends to take a lot of toll on each person. Men do get breast cancer, as Mr. Heron said earlier, but what we have found is that there are far fewer men that get it, and the challenge is that it tends to be found at the end stage of the illness. And so this is a call to all the men who will watch this webinar at this time or at a later time, as it's being recorded based on what Dr. Carr said, to please get checked, please get tested. Don't ignore that lump that you've noticed. And the same thing goes for all women. any lump, whether it's in the breast or any other area of the body, please get it checked. It's better to find out. Ignorance is not bliss. It's better to find out and be able to handle it and deal with it as best as possible to give ourselves a longer chance at life and better quality life than to leave it to chance and then be sorry. One final plug for the Jamaica Reach to Recovery, just to indicate that we have dry fit t-shirts for sale for $1,500 and our masks with the Jamaica Reach to Recovery logo for $800. These are available at the Jamaica Cancer Society office. For me, I'm Julie Lynch, and in 1999, at the age of 28 years, I found that I had breast cancer. I'd noticed a lump from maybe a year or a little over a year before and kept checking it. I said, well, it sort of comes up at the period, at the time of the menstrual cycle. So perhaps it's tied to the period. And so I didn't get it checked. It wasn't a traditional lump as the doctors would put it. It's more like a thickening of the inside of the left breast. The thing that got me concerned why I followed it up further is that I noticed that the right breast didn't have the same thing. And so I stopped by the Cancer Society and I saw a nurse that I knew. And she said, Julie, what you doing here now? And I said, Nurse White, I don't know when I feel this lump. And she said, come, I'm the nurse here who does the screening. They're not going to give you a mammogram because of your age, but we can do the breast exam. When she went into the room, she was chatting and laughing because, as I said, someone I knew. But then, as I call it, she put on her nurse face while she did the examination. She just got very serious. And I said, this is not good. She said, does it hurt? I said, no. She said, that's an additional issue. I said, what do you mean? Talk to me. She said, lumps that do not hurt and are feeling the way they feel gives her a concern that I need to get a biopsy done. When I did the biopsy, it came back that I was at stage 1 breast cancer. I asked them if they could save the breast. They said, my breasts are tiny. I said, Lord, look how me did always a beg for big breasts and it never worked out. But anyway, so I said, all right. And the other issue is that they said that it was too near to the nipple and that it would be a challenge to save the breast. And they would be dimpling because one would be larger than the other. So I said, okay, doctors, take it off. I was very practical about the whole thing. But I was also very concerned about the chemo. I didn't want the chemotherapy. And I must say thanks to the workplace because the doctor who was looking after me made contact with my supervisor because he asked me to go ahead. He said, I want to contact your head of department because I know her. Can I go ahead? And I said, sure, doc. And she called me to her office and she said, Miss Lynch, doctor spoke to me. You need to take the chemo. He says if you don't do it, within a year, you'll be out of here. But if you do it, you'll have a much better chance of a longer life. Well, I did the chemo. It was so horrible that I won't tell you what it was like. The only thing I will tell you is that it affected my heart. And for a long time afterwards, I had heart palpitations and heart racing. Apparently because of what they used to do is alternate dosage. So one part of the month I would get what they call a high dose, a strong dose, and the other part I'd get the low dose. And when I got the high dose, one of the meds seemed to be the one that impacted my heart. But thanks be to God, I'm still here. It's been over 20 years and it really wasn't bad. And it has tapered over time in terms of the feelings of the heart racing and just feeling like it's pulling out of my chest. I haven't had that for a while. For 5.5 years, I took some hormonal treatment called tamoxifen, which was part of the package of treatment that was recommended for me. When they did the checks, they suggested that the radiologist suggested that I don't do the radiation therapy based on all the factors and because it was stage 1. So I didn't do any radiation. Wrestling with God. That is something that really happened to me. I said, Lord, this is what kind of story it is? Because at 28, I'd gone through so many major illnesses already. That was like probably my 4th major surgery. And then afterwards, since that, I've had maybe about 2 more majors and a couple of minors. I've always had gynae problems. From late teens, I've had gynecological problems. I've lost ovaries, I've lost tubes. They eventually did the hysterectomy and took out the womb. It's been just a series. I had borderline malignancy in one of the ovaries. It was just one after the other. And so at 28, I felt like I'd already got my fair share and it was supposed to be smooth sailing now. And I was like, Father Lord, wait, this can't be happening again. No, sir, I need a break. And so I did go through that major wrestling. And I remember one night I went to bed, but I wasn't sleeping. And a presence came into the room. It was like a man at the door. I was thinking, who is that? But I was in a family home with a lot of family members, and they don't normally come to the room door at night. But I said, maybe there's a little emergency. But at the moment when I felt scared, immediately I felt this reassurance come over my spirit. And I recognized that it wasn't someone that I knew. And the gentleman came over and he just placed his hand right between my shoulder and my neck area. And I felt such a calm and a peace. I didn't even tell anybody. I said, they're probably going to think me gone loony. But since that, I have been just more able to handle whatever life sends my way. And I said, who could it be but God himself paid me a visit? And I said, thank you, Lord. I know that you didn't send an angel. You came yourself and said to me, Julie, I've heard you. I've heard you. And I understand. And I'm here for you. Whether it's storm, whether it's rain, whether it's sunshine, I'm here for you. And so since that, I've just been growing with him and thanking him. No matter what comes, I'm saying, Lord, I know that we're in this together, and you and I are an army that no one can defeat. And so that is a real reassurance for me. Workplace. While I went through the chemo, I had to be stopping from work because I was so sickly. I had to be stopping from work in and out. And I'm a civil servant, career civil servant. And I really have to say thank God for the government service, because they've been a tower of strength. They've been a good support. They've allowed me to get the time off needed during the treatment and subsequently. I go to clinic once a year for follow-up checks, and I get the time off as needed, and really not a challenge. Since the COVID, I've been thinking that now is the time that anyone going through any major illness, whether it's cancer or otherwise, we need to take our health in hand. We need to take our health seriously. We need to look at our foods and our drinks and recognize that in them is the life. And we need to make sure that what we're eating and what we're drinking is healthy for us. So that if we know that green juices are good, let's make those green juices. Let's get our kale, let's get a little carrot, put some apple in there, jazz it up, nice it up. If you like ginger, put some ginger in it. Make that smoothie, make that drink. Reduce the time spent buying fast food. It's convenient, but it has an after effect. Those saturated fats and all those things that are in there, I tell myself, nice to the mouth and bad to the body. So be careful of what you put in your mouth, because it will help you have your nuts, have your shakes, eat well, reduce your oils, reduce your sugars, your starches. I know I'm not a doctor, I'm not a dietitian, I'm not in the medical world, but this is just practicality. Things that we need to do to ensure that we have the best possible life, the longest period of time. Over the years, childhood cancer has been something that has been on my heart. I used to be a member of an optimist club, and we had a childhood cancer campaign, CCC. And what we did, the group used to go to visit the children at the Bustamante Children's Hospital and take little practical supplies. So if there were small children, they would take diapers, bigger ones, they would take, you know, whatever is needed based on the parents and guardians. And so this is a challenge I'm throwing out, especially in these times of COVID, when parents are probably earning less. Some person's salary have been reduced. Some person's earning power have been cut. Some people have lost their jobs. If there's a child that you're aware of, other children who have cancer, have the leukemia, or whatever other type of cancer that is affecting, find out if there's anything that you can do. There's an organization at the UHWI or as individuals that can assist that family, because the emotional pain and stress, the struggle of everything on top of the financial is not an easy road. It's not an easy path, because one thing for sure, cancer is not a cheap disease. Even if you go through the public health system, there are things you have to go to buy, like medication. Some of them not even sold in the regular pharmacies. You have to go to the drug serve and to the distributors to get them, and they're scarce. So any reprieve that we can do to help the families and support the families is a welcome one. And one thing I want to suggest to each and every one, if you've found that you've had a cancer, I believe that talking about it and sharing it with the right person, as Ms. Satchwell said, with the best energy, the people with the good energy, share it with someone, don't keep it in. Internalizing cancer and the fact that you have it is not a good thing. And I believe personally that it reduces your lifespan. I think that if you tell someone, have confidence that you can tell and share it with. It eases the burden, it takes off that pressure off you, and it helps. And so my closing words, support each other. We are one in this little island of ours. So I really want us to support our neighbors, look out for that loved one, be practical. That person over there is going through that cancer illness. As Ms. Satchwell said, don't even bother ask them what you can do for help them. Just offer them the help. Say to them, you know, I brought you some groceries. I know you're probably not so strong to go down to the supermarket or the market. So I brought you a little bag. They don't really want you to spend no big money, you know. It can just be a 2 grand or a 1 grand. They never know how much the very thought is appreciative to them. And they are so glad for the care and the kindness that you give. And so I encourage us all, get tested, get checked, share your experience with others, love God, love yourself, and be kind to your fellow man. Thank you.
Are you sure you're not a medical doctor?
At all.
I
always I come through the medical system by natural means in terms of learning along the way from ill health.
Wow. Yeah, no, I've listened to both of you, and what amazes me is that having cancer, most persons will see as a death sentence. but both of you had a spiritual connection with God. And you thought to yourself that this is not the end. This is not the end. And there is something that I personally can do, and I will try my very best to make a difference. So I must applaud you on that. You know, I really, I'm lost for words. I'm lost for words. And I must inform the audience that I've only yesterday made connection with both Miss Satchwell and Miss Lynch. Only yesterday. And they were willing to participate and share with us today. I'm lost for words. Ladies, I am lost for words. I see that the chat is very active, so let me check on it while I try to get my breathing together. Right? Thank you very much. There is a question in the chat. Could you each speak about your experience with live foods or raw foods? Live foods or raw foods? I think they're vegetables.
May I?
But yes, go ahead.
Is it a question? Is it for later or for now?
You can no.
Okay, because one of the things that happen, especially from a nutritional perspective, especially with raw food, is the nutrients that you get from it. Because what will happen is that a lot of times when we cook, and especially the cooking method that we choose, we lose a lot of our nutrients. What I say to persons who are going to go for raw foods is the source from which you get your food, because it's not you just deciding to have your green juices or whatever else that you want to have. Is how you select your foods and the source from which you get them. For example, I'll use carrot, for example. If you're going to do juicing of carrots, you need to understand that this is a carrot, and you need to measure the carrot 1.5 inches from the root and cut off that bit. And then I think it's 1/2 inch from the top. Because what would have happened, especially if you're not sure of the source from which you're going to be sourcing your vegetables. For example, if chemicals were used, the chemical is going to be in the vegetable that you're going to be consuming. And therefore, we normally recommend that you cut off at least 1 inch or 1.5 inches at the bottom of it and have the middle bit. So for persons who are just going to go in the supermarket or in the market and buy vegetables or whatever else that you're going to be buying and using it, what you'll find that when you think that you're helping yourself, you are doing a lot of damage to yourself. Because if, for example, you are going to be purchasing vegetables from a property that was sprayed with gramazone or anything of the sort, you put gramazone in your soil, you cannot really plant any food item in that soil and get good quality until at least 6 years after you have sprayed it. And those are some of the things that persons do not understand, and they will say, how is it that I'm having raw food or I'm having live food and I'm not keeping well? You're eating the food, but it's the quality of the food that you're eating. And that is why I always encourage persons, if you're going to go the alternate way, or the natural way, you must always be guided by somebody who is appropriately trained to do so. The same way, when you want to go to the conventional doctor, you want to know what is the best doctor in Kingston who is specializing in whatever. But when it comes on to alternate medicine, you go in the corner and go to one bushman. The bush thing don't work, because what you need to understand that there's a science to everything that we do, and especially to food science, and you need to understand that there are consequences if you're going to have a combination. Just as how the doctor will say to you, if you're taking antibiotics, you have to avoid alcohol and dairy products. It's the same way when you're taking you're taking natural remedies, that you need to understand that there are consequences to it also, right? So it's one of those challenges that I say to a person, because I have been on alternate medicine for the last 6 years. And because I had gotten to the point where I was told that there was nothing further that they could do for me on conventional medicines. And for the last 6 years, all I have been taking a conventional is alternative medicine. But I had to find somebody who was appropriately trained to do so, which is why I'm here today. Because other than that, with my prognosis, because after I finished all my surgeries, chemotherapy, radiotherapy, hormone treatment, I was told it was only 33% successful. And I was given a time frame in which I would have survived. And
Yes.
I have tripled and more than tripled that period since then. And it is because I'm under the care of somebody who is appropriately trained to do so. So I say to persons that it is something that you could go down the road to do it, but you have to give good thought and intelligence and intelligent thinking to it. You just can't get up and say, we're going to go to a man on the corner and you're going to give me some bush for drink. That's not often helps you.
That's not going to work.
That's detrimental. It's detrimental.
Yes.
Okay. Thank you.
All right. Thank you. Dr. Aiken, the platform has been laid, and we're moving now from the breast to the prostate. And this is something that Jamaican men in particular don't like to discuss or even want to venture down, right? So I am going to turn over to you now to make your presentation to us in this regard.
Thank you, Tamar. Before I make any presentation, I just want to say that after listening to those two riveting, compelling, and moving stories from both Miss Satchwell and Miss Lynch, I think anything that I have to say will be anticlimactic because, you know, when you hear it from the horse's mouth, when you hear it from persons who have been through it, when you listen to their story, an authentic story, a real story of someone who has experienced, you know, the mental anguish of being diagnosed with cancer and have had to go through all the different treatments. There is really nothing, you know, there is really nothing more that can be added to that. And so, you know, as they were talking, I thought to myself, would it not have been good to have got a prostate cancer survivor to have spoken about prostate cancer? Because you see, the truth is, over the years, and I've given many talks, and people have heard these talks again and again. But I think when you hear a survivor's story, a real authentic story, it does a lot more for people than what the doctor, him or herself, can tell you. So I really want to say to Miss Satchwell and Miss Lynch, I have been really moved and touched by both your stories, and I want to encourage you to continue encouraging others through your authentic stories to, you know, to do their breast screening and to encourage those who have been diagnosed with breast cancer, especially when the doctors have written them off. I think Miss Satchwell and Miss Lynch are living testimonies to the fact that you know, there is a hope and life even after the doctors have written patients off. All right, so with that said, let us talk a little about prostate cancer. As I said, anything I have to say after those two ladies spoke is really going to be very anticlimactic. But prostate cancer is a major public health problem, not only in Jamaica, but in the Caribbean. It is by far the most common cause of cancer-related deaths in both men and women. So what I mean by that is that when you look at the number of deaths from prostate cancer, it far exceeds that of breast cancer. It far exceeds that of lung cancer, colon cancer. It is really a major public health problem. The Caribbean, up until 2 years ago, had the highest prostate cancer death rate in the entire world. with better reporting coming out of sub-Saharan Africa, they have relegated us to number 2 position where the death rate from prostate cancer is concerned. So that just, I want to put it in context that, prostate cancer is a major killer of our men. The thing about prostate cancer is that when it is early, when the disease process is early, when it is still curable, it does not produce any symptoms in the man, no symptoms whatsoever. And so a man can have a cancer that's growing inside his prostate and getting bigger, and he is totally and completely unaware of it. When he becomes aware of it, when it starts causing symptoms, it is generally locally advanced, meaning it has spread beyond the confines of the prostate. And this is part of the reason why the death rate in the Caribbean is so high, because men wait until they have symptoms. Men do not have the sort of health-seeking behavior that women have, and the sort of preventive health maintenance checks that women do. We don't have that sort of culture. And so we commonly wait until we have symptoms developing. And almost invariably, if you wait until you have symptoms, it is going to be either far advanced locally, or it's going to be what we call metastatic. It would have metastasized or spread to other sites in the body. And this is a challenge we're having in not only Jamaica, but the Caribbean. And this is why the death rate from prostate cancer partially is so high. There are only 3 risk factors for prostate cancer. Being of African ancestry, having a family history, not only of prostate cancer, but breast cancer. So the brothers of women with breast cancer, or the sons of women who have had breast cancer, are at increased risk of dying from prostate cancer. Of course, if you have a family history of prostate cancer, you're at higher risk. But it's not just prostate and breast cancer. It is also ovarian cancer, cancer of the lining of the womb, what we call endometrial cancer, and indeed pancreatic cancer. So now we are more aware that it's not just a family history of prostate cancer, but indeed a family history of those cancers that I just mentioned that puts a man at increased risk. The thing about it, though, is that 90% of prostate cancers are not associated with a family history. So not having a family history of any of those cancers does not mean that you're out of the woods, because 90% of newly diagnosed prostate cancers, men did not have a family history. And then the other thing is that in our culture, a lot of men are not aware of their family history. A lot of men don't know their father's side of the family, or they may be estranged with their fathers, and so they're not aware of the paternal side of their family history. So the third risk factor is age. Prostate cancer is uncommon, extremely uncommon below the age of 40, but with each progressive decade of life, the prevalence of prostate cancer increases. Now, one of the important things to understand about prostate cancer, and it's very, very important that you understand this, is that prostate cancer is not a homogeneous disease. It's not a uniform disease. It has a wide spectrum of what we call biologic aggressive potential. And what that means is that at one end of the spectrum, you will find that there are men with prostate cancer that runs a very indolent course, and they will live to a ripe old age with their prostate cancer, and they will die from other causes associated with old age. But then at the other end of the spectrum, you have very aggressive prostate cancers that, when diagnosed, if not treated with alacrity and with urgency within a fairly short time, men will die from prostate cancer. And this more aggressive type of prostate cancer is especially common in younger men diagnosed with prostate cancer. Now, the dilemma we face as doctors is to selectively try and identify those men who have the aggressive forms of prostate cancer and treat those men aggressively, while leaving alone those men with the indolent forms of prostate cancer. Because those men with the indolent forms do not require any treatment. If you treat those men, you end up giving them the potential side effects of treatment for a cancer that would not have caused their premature death or any sort of morbidity. And so that is where the real dilemma in managing prostate cancer lies, trying to selectively identify those patients who are destined to die from their prostate cancers. We are doing a much better job of that now than, say, a couple decades ago. And there are a few new things in our armamentarium that allows us to do that. One of those is multiparametric MRI. Multiparametric MRI, which is a special imaging tool, allows us to selectively identify those cancers that are of a higher grade and are more likely to result in death, and deliberately misses those cancers that are of a better grade and unlikely to result in the death of the patient. Of course, there are two beginning tests that we do on patients when we're screening them for prostate cancer. One is the infamous digital rectal examination, where the doctor puts his or her gloved and lubricated finger in the patient's rectum and takes advantage of the relationship between the rectum and the prostate, because the prostate is immediately adjacent to the rectum. And through the rectum, the doctor can feel the consistency of the prostate. The normal prostate feels like the tip of the nose. What we're feeling for is whether there's any hardness, like my knuckle. And if we feel that, then that means we suspect prostate cancer could be present. The other test is a blood test called the prostate-specific antigen blood test, which is used along with the rectal examination to determine if there is any suspicion for prostate cancer. In 2020, if there is a suspicion, we send the patients to do a multiparametric MRI that will help us to determine if this is likely to be an aggressive cancer or not. And it helps us also to target the particular area in the prostate. So it helps with the accuracy of the biopsy when we're taking tissue from the prostate to send to the pathologist. Now, how has COVID affected the treatment of prostate cancer? As you know, prostate cancer is a disease primarily of aging men. The peak incidence of prostate cancer occurs in men in their 70s. That's not to say, though, that prostate cancer doesn't occur in younger men. It occurs in men in their 40s, 50s, and 60s, as well as older, but the peak incidence is in men in their 70s. This is the same age group of persons who are at highest risk from COVID. As you know, COVID produces more morbidity and a higher death rate in persons who are older. So it's the same age group of persons who are afflicted with prostate cancer who are most at risk of dying should they contract COVID. So one effect it has had on our patients with prostate cancer is that it has made them reluctant to come out of their homes, especially in the early parts of the pandemic, when there was a lot of uncertainty. There still is a lot of uncertainty, but especially early on, patients were reluctant to come out, and some missed their dates, appointments for treatment, critical treatments. And of course, that would have set them back in terms of managing the disease. The other effect of COVID is that it has severely limited our operating time. those persons who have been diagnosed with early prostate cancer, in which it is potentially curable by removing the prostate, we now have less time to do these elective cancer surgeries because of the overwhelming depletion of both human resources as well as other resources at a hospital like the university hospital. Or anesthetists and critical care physicians, for example, who normally provide anesthesia for us, they are on the front lines managing COVID patients. And so our operating time has been curtailed to allow them to do their, to channel their resources towards treating COVID patients. So these are two direct and indirect ways in which COVID has affected our patients with prostate cancer. There are other ways, but those two ways come to mind readily. And so I'm going to stop here, and I don't want to overstay my visit. I'm going to stop here, and I'm very happy to answer any questions that you may have, or speak further about prostate cancer.
Thank you, Dr. Aiken. I have one question that runs through my mind is that, yeah, as a man, we wait until the last minute before we go see a doctor. Right? We have to feel some excruciating pain first. In what way can you, or is there available to encourage Jamaican men in particular, with the type of thinking that we have, to get tested?
Okay, I'm glad you asked that question. I must tell you, I am deeply disappointed in our men, especially our men who have been diagnosed with prostate cancer. Deeply disappointed. Why do I say that? Over the years, I've seen many influential people in a position of influence who have been diagnosed with prostate cancer. And I have always felt that if these persons were to come out publicly, and these people, a lot of them, many of them have been successfully treated. They've gone years post treatment, and for all intents and purposes, they have been cured of prostate cancer. But for some reason, men do not want anybody to know that they've been diagnosed with prostate cancer. I've had cases where some men don't even want their immediate family members to know that they've been diagnosed with prostate cancer. I have felt that if these men, especially men in a position of influence, were to come out and say to other men, look, I have been diagnosed with prostate cancer. I had treatment. I am fine. I am here to tell you the story. I'm doing well. Just like how Ms. Satchwell and Mr. Lynch told us about their experiences this morning. And especially since they were literally, seeming to have been, especially in the case of Ms. Satchwell, at death's door, and she's here to tell the tale today. That would have a much more impactful and large, much more powerful influence than my coming and telling people about prostate cancer. And so I'm very disappointed because I feel that would make a big difference. The other thing I think that would make a big difference is if we had somebody championing prostate cancer, somebody like a Usain Bolt, or if he's not old enough, somebody of his stature and his level of popularity who could champion the disease and tell men to go and get tested and, man up and go and do your test. I think that would have a significant impact on our disease. We have been doing things the wrong way, and I've spoken about this, I've written about this. What we have been doing over the years is that the Urological Society, the Cancer Society, we have been having seminars at the Pegasus and at other hotels. And of course, who is going to come to these seminars? It's the middle class and people who are already very well aware about prostate cancer. So although they are well-intentioned, what we have done is unwittingly increase the disparities in terms of prostate cancer, because the average man on the street is not coming to those places. Even though it's free and you're providing food, they're not coming. What we need to do is to go into the communities where men are, at the sporting events, at the bars, where men congregate, and we need to tell them about prostate cancer. So I think if we did those three things, I think if men who were diagnosed with prostate cancer would speak up, I think if we had a champion, and I think if we stop doing what we've been doing and focus on community efforts to increase awareness of prostate cancer, I think we would start winning the battle.
Quite interesting, because last month, as I said earlier, was prostate awareness, and I'm quite sure most persons has never heard that even existed. So maybe we need to start advertising publicly about it, just to sensitize people that this exists, and indeed, as you said, is a leading cause of death in the cancer family. So then people might then take it on a little bit more seriously. Because I have briefly looked at the figures, and it's quite staggering, to say the least, you know. And so we will have to start campaigning in said regards.
Yeah.
Mr. Heron, may I make a comment, please?
Sure.
In relation to what Dr. Aiken have said, in 2015, was when Mr. Blue Cancer Care Foundation had its first health fair in Westmoreland. And leading up to the health fair about 2 months before, what we did, we strategically went to where the cane farmers were having their lunch break. We would go there when they have lunch break and start up a chat with them. We know the guys play football on a Sunday morning. Go sit down on the road bank and hold a talk with them. And we went into the schools and we had 5Ks. And when we had our first health fair, we had 370 odd persons who turned up, and over 70% of them were males. They were males. And what we found is that there's always this thing where we accuse men of being homophobic and not wanting to do the rectal examination. It is an issue, but it came about not so much because of the homophobic belief, but because you have a taxi rank, yes? And you know the taxi man with the biggest mouth. He will go down there with misinformation. And once he talk loud, everybody believe him. And pardon my French, but from him opening mouth and tell us a prostate cancer gonna make you dead, members say no taxi man now go to no examination. Okay? They're not going because they will tell you point blank, say, Miss, me now make no doctor pick me cherry. And I would rather die first before my dick die. That is what they told us to the face. But what we started to do is to go into the communities and start having one-to-one and allow them to ask us questions. And we have some men who have survived prostate cancer, and they were able to say, look at me go through it, me look what, and tell them what was happening to them. And this fear that they have of impotence is another thing that is causing them not to go. But once they understand that prostate cancer is one of the most treatable cancer, and therefore, if you are diagnosed early and you go through your treatment, there's no need for you to have anything dead. And that is why I really, really embrace what Dr. have said, because it works. It works. What happened in Westmoreland, I can tell you, we have more men coming out to our health fairs. We had one just before we had COVID, and it was supposed to be between 10 and 5 o'clock. And at 8:47, we had the last young man. We call him young because it was young. And he said, Miss, me leave me yard to come here today, come do me digital. I mean, now go home and don't do it. Because what happened is that he did the PSA, the blood test from earlier on, but we never had enough doctors to do all of the digital. And they sat there and they came on from 10 a.m. and it was 9 p.m. we closed the night, and they stayed. They just need to have the correct approach, and we cannot sit in office and tell them, so you need to do so. They need to have an understanding. And that is how we are going to save our men. So I really, really endorse what you're saying, doctor. Thank you.
Well, quite interesting. Just to point out, I have unmute all the mics are unmuted, and so persons can ask their questions or share their comment while we have for the next 5 minutes, just to see. But tell me, Miss Lynch and Miss Satchwell, what was it like having the family support? How within the immediate family, what kind of support system mechanism was there? I'm still trying to formulate the question. What was it? What was the support like, having been diagnosed?
Miss Lynch, you're gonna go first, okay?
Yes, I'll go ahead. My family situation is that I lived with my mother until about age 9. Then I moved to my father's relatives, where his sister raised me, and then she passed away when I was 19. And then his other sister took over where she left off. So I wasn't with my immediate parents, but I did feel that the entire family came together. I think for a long time, they didn't know how to handle the situation. It was very hard. And I think there was a lot of uncertainty, but I never felt like they abandoned me or anything. They were there for me. And they dealt with it, as I always said, they'll deal with it how the Lynch family could deal with it. So we're not a touchy-feely, huggy family. We're very reserved. And so that happened that way. But I really am grateful for having the family support, the church support, and as I said earlier, the workplace support.
For my biological family, I was living in England at the time with my son, and the rest of the family, they were back here in Jamaica. It was very, very difficult for my mother because my sister, my older sister, had just recovered from cancer. So my mother would tell people that she has been through cancer twice. And it was difficult. My mother suffered from a sickness called bawling. My mother bawled for everything she bawled. So I said to her, my mother, I'm in England, you're in Jamaica. What I need you to do is to go in your community, find somebody, and all the care that you would want to give to me, give it to that person, because you can't give it to me. And when you give it to that person, God will provide somebody to give it to me. I have 2 of my sisters who, I don't know if they spoke to me 3 times during the 18 months of my treatment. And I guess from the perspective that I'm also a qualified counselor, I could understand that they were not alienating me, but my sisters were listening to what the doctors were saying, and they all thought I was going to die imminently. And therefore they put up that barrier. Because for them, if they didn't stay too close when I die, then it wouldn't be that hard. The most difficult one that I went through, though, was my son, who lived with me. I had my surgery. He started his exams, his second year university exam, the Monday, and I had my surgery the Thursday. And they never thought I was going to survive the surgery. So my son had sort of distanced himself from me. And one morning he came into the bed and I could feel the bed shaking, and I hugged him and he pushed me off. And with tears running down his eyes, he said, "Mom, why don't you just die? I can't do this anymore. Just die so that I can get over with it. I can't get up and live like this every day. I can't answer my phone. I can't sleep. I can't study, because every time the phone rings, somebody's going to tell me that you have died. Just die now and get over with it. I can't do this anymore." I know my child did not want me to die, but that is how he was feeling at the time, because he felt that if I die, then at least he could keep living, because he felt he wasn't living. And all I could do was hug him and tell him that I love him, because I know that my son did not want me to die. I know my mother had gotten upset at him and said, "How could you do that to your mother?" I said, "Leave my child alone." And these are things that the parent-child, the husband and wife relationship, they are difficult, they are challenging. When I went through chemo, after I finished chemo, one thing you need to appreciate with chemotherapy, depending on the combination that you had used, your body odor changed completely. Whenever time I leave my son and I go anywhere, I cannot change my bed. And the last piece of clothing that I wear, I always have to leave it home. When I go back home, all you find in my wash basket were t-shirts because my son would wear my t-shirts. And know what was happening with him is that I was sick. He couldn't cope with the bald head. But what happened is that he said, I didn't smell like myself anymore. When he went in my bed, it was like he had already lost me because your body odor has changed completely. So there was nothing for him to hold on to. The shape of my face had changed. I look like a hamster. I look like when you turn a spoon back way. That's what the shape of my face. I had moved when I started my surgery, my first surgery, I was wearing a size 10. And by the time I finished my treatment, I was wearing a size 26. Yes, because of the steroids that I had taken. So I don't look the same way. I don't smell the same way. Nothing. So my child had lost me. And those are some of the psychological and physical challenges that our family members have to bear. My complexion had changed so much. My grandmother saw me. And my grandmother said, what the hell has gone wrong with you? She said to me know people from Jamaica. What she said? Black people from Jamaica go foreign and come back white. You left Jamaica white and come back black. What the hell is wrong with my granddaughter? Because she couldn't cope with it. And these are the things that they have to deal with. And I have to say to grandmother, it's me. She said, no, you know, my granddaughter, you're too black. My granddaughter was brown. Because the medication that I had taken, it caused my complexion to change drastically. So my son couldn't cope with me because my shape changed. I was huge. I was smelling different. My grandmother couldn't recognize me. She literally looked at my mother and said, where is my granddaughter? So those are the challenges because people tend to believe that you're diagnosed with cancer, or her head bald, so she have cancer, she'll go through the treatment. But once you grow back a strand of hair, she better know she all right because she grow back hair. My experiences, the negative experiences that I had with cancer started more when I finished my treatment than when I was going through my treatment. The 9.5 years of survival have been far more difficult than the 18 months that I went through cancer. So I said that I didn't want to tell you about my thing because it's frightening.
Yeah, yes, I know. That's tough. That's what you call a bitter pill to swallow.
Mr. Heron, I have to endorse what you said about the smell. You smell different for true, and your smelling is different. I used to always say, oh goodness, everything smells awful. But I also recognize that my body odor changed as well. So I also smell different. So I can really, my complexion changed, but not so much. But I remember my entire fingers went white and French tips were in, and people used to say, I love your French tips. And I used to say, thank you. And then I'd smile inside. I said, they wouldn't know it's the chemo changed the finger colors.
But you see, both of you have good sense of humor because it seems like that is what is needed the thrust to push you through yourself to make sure that you can get through. And I guess it will be the right kind of energy that will be needed because as was said earlier, based on your energy, then persons that come around you will automatically or should automatically start to feel at a high. And so I am very encouraged by your story. And I know all those who are listening in are touched as well by it. And as Dr. Aiken had said, definitely we need to start taking our health more seriously and to make sure that we need to get away from this overphobic kind of thinking mentality and get tested, because it literally means saving your life, literally, but one thing that they have always said, that all good things must come to an end, and this is certainly a webinar that I would love to go on forever, but unfortunately go ahead, Miss Lynch.
It's just one quick thing.
Sure.
The women in the men's life have a lot of power and are able to give more support. Women have to find ways and means of not nagging their men to go to the doctor, but still finding gentle and good ways to get them to go to the doctor. I remember this doctor said at a service I went to that he had been a doctor for 26 years. He never even looked 26, but he said he had been a doctor for 26 years and that the women would come little. He said many a times he didn't know what was going on in the early stages, but it was noted in their records. But he said most time when the doctor came, the men came, it was palliative care. Could do nothing more for them. It was end stage of whatever the illness was, and he was just trying to keep them comfortable to the close. And so I need for us to figure out a way to have our women empower our men to go and look after their health for the prostate and for all the other illnesses that men go through.
Sorry, Mr. Heron.
Yes,
Sorry.
go ahead. Go ahead.
The women
Ms.
work.
Lynch and then Dr. Aiken.
The women work, but I find something else that works even better than the women. Granddad, do you know what I want to be when I grow up? I want to be a pilot, Granddad. And you know who I want at my graduation? Granddad, if you don't stop smoking, you will not make it to my graduation. Ooh. Granddad will stop smoking. Because wives are very nagging people. Yep. Yeah. You know, that's in it. Every woman is miserable and nagging. Grandchildren are lovely. And every grandfather want to go and talk about my grandson who's a pilot and my grandson who's a doctor. Grandchild tell granddad say want him to come and graduation, but he's not going to come if he don't stop smoke. Granddad will stop smoking. It has worked.
Yes, I think those 2 points are excellent points. And in fact, in reality, a lot of men are brought to the doctor kicking and screaming by their significant others, by their wives and their girlfriends. A lot of times, it's the women who bring the men to the doctor. And I think another way of reaching the men is through the women. The other point that Ms. Satchwell made is also a very valid point, you know, and it's a point we use when we're trying to convince men to get screened as well. We speak about them being around to see their young children grow up, get married, have children, and those grandchildren, you know, live to see those grandchildren be successful and so on. So that's another strategy that can be used, and both of them can be very successful.
I just looked over my monitor just now, and I saw my colleagues, men of course, who are saying, yeah, thumbs up. You know, women need to get nagging, get us out, get us pumping, because in truth and in fact, they are the driving force. So many of our decisions, no doubt about it. And so I'm glad that was actually said by a woman. So, you know, I'm thankful for that. You know, I'm going to invite Ms. Richards to bring word. Ms. Richards is our deputy librarian. Ms. Richards.
Good afternoon, everyone. Just to say that Dr. Carr apologizes for having had to leave as she has another meeting. And to say thanks very much on behalf of the UWI Mona Library for this very informative webinar through the heartfelt testimonials of Ms. Satchwell and Ms. Lynch and Dr. Aiken's medical expertise. And I trust that the webinar will encourage us all to be more proactive in our personal engagement with both breast and prostate cancer, as well as encourage us to engage our relatives and friends to do so. And thanks very much to the committee led by Mr. Heron for another very informative, and even though he's speaking about health issues, what I found very inspiring presentation webinar. So on that said on behalf of Dr. Carr, of course. Over to you, Mr. Heron.
Okay. And then again, no, so I would just like to say thank you to the presenters, Ms. Lynch, Ms. Satchwell, Dr. Aiken. Here at the library, we'll try our best to continue to educate the community about taking care of me, because with the COVID-19 pandemic, we are now fearful of what might happen to us. And terminal illness or not, we are fearful of it. So I'm very much moved by the presentation here today. And I am really thrilled that, at the last minute, literally the last minute, just like the disease itself, right? At the last minute, you decided that you are giving it a fight and you are here today, right? And here at the UHWI Library, we greatly appreciate it. And we would just like to encourage you to keep on fighting, right? And we know that little by little, we will be able to make a change and make a difference. And Dr. Aiken, I am going to try my best to see how much I can promote, educate all about prostate cancer, because as I said, I saw the numbers and it's staggering. And so I just like to tell you, thank you very much once more for being here. And I have your numbers, and believe you me, the first person to ask, where can I get a survivor? I'm going to pass that number on, because your story needs to be heard, that because it sends hope. It sends hope that breast cancer doesn't write you off, prostate cancer doesn't write you off, but early detection is the key.
Thank you.
Thanks once more for being here and sharing with us. Greatly appreciated.
Thank you.
Thank you. All the best.
Thank you.
Bye.
Many blessings.
Blessings to you too.